Hello, good morning. I am Zenab Husain, the Project Director at BII World. Today in our Healthcare Dialogue series, we have Dr. James Gutierrez. He's an internal medicine physician by training and has been with Cleveland Clinic for over 20 years. In his current role, he's responsible for developing the quality, patient safety, and patient experience program for Cleveland Clinic London, which is due to open its doors in early 2021. We would like to wish the entire team of Cleveland Clinic London for this very promising venture. So we're really excited to have Dr. James on board as a keynote speaker at the second annual Patient Experience and Engagement Summit in October. We'd really like to thank you so much for your time, taking out time from your busy schedule to join us for our Healthcare Dialogue series today. As the healthcare industry adapts to COVID-19 as part of its new normal, I'm sure it has a slate of patient experience lessons to take with them. The industry is indeed tasked to recalibrate their patient engagement strategy for maximum agility and optimum sustenance. Setting that thought as the backdrop of our dialogue today, I would like to ask you to share your experiences of the biggest challenges that your organization has faced as a result of COVID-19, and what were the major lessons learned?
Yeah, thanks, Zenab. And first of all, thank you for giving me the opportunity not only to speak today, but also to speak at your upcoming conference. I'm really looking forward to that. I think I'll answer that question in two ways. I'll talk a bit about how, the lessons we learned as an organization at Cleveland Clinic, and then talk specifically about what we've learned in our London project. At the Cleveland Clinic level, I think, as you know, we are a large health system based in Ohio with over 10 hospitals there, but also with hospitals in Florida and operations in Nevada, Toronto, and a hospital in Abu Dhabi. So, clearly this pandemic affected us at a global level. And I think the lesson we learned is that it's important to be prepared and to plan and anticipate challenges as much as possible. I think the biggest challenge for us as an organization is that we very quickly had to cease all non-essential surgeries, which are the biggest part of our operations, and shift our focus to preparing for a possible pandemic surge in the areas where we operate. So, that was a huge challenge. But I think because of excellent communication that had been developed throughout our organization, and because we had disaster plans that had been not only created, but practiced over the years, we were able to do that successfully. We were able to close down operations, notify our patients, really switch to virtual visits largely, and prepare for a possible surge in COVID cases, especially in Ohio, where we very quickly turned our health education campus into a 1,000-bed hospital, which fortunately didn't have to be used because Ohio was spared the worst of the pandemic. I think closer to home here in London, COVID really required us to shut down our administrative offices very quickly and with very little warning. We had to pivot very quickly to remote working and continue to be focused. So we certainly learned a lot about that, both about how to use technological platforms as well as how to change the way we work together on a daily basis to keep on track. Unfortunately, we couldn't do much about the construction situation because with the significant impact of COVID on London, construction at our hospital, ground to a halt for several months. Fortunately, though, we're back on track. We have new dates and we're really starting to get people back into the office. But I think we're all going to be better and more efficient workers based on what we learned during the time of the pandemic.
I totally agree to that. I think it's a battle in real sense, and to look at the positive side of it, we are trying to live in the new normal and come to terms with it. And I'm sure there are better things that await for us in the future. With this, I'd like to ask you, this takes me to another question actually, which is also, please, in your opinion, describe how technology solutions have helped to solve some of these problems with regards to the pandemic that we are facing. whether it's with increasing workflow efficiency in the hospitals,
Hmm.
detection using artificial intelligence, digital command centers, or even virtual visits that you just mentioned for
Hmm.
management of COVID patients.
Yeah, absolutely. I could think of a couple good examples there, Zenab, and I think the most important one for us at Cleveland Clinic was the expansion of virtual visits. We were fortunate in that we had been emphasizing with our doctors and other caregivers virtual visits for many years, and we were seeing a consistent rate of growth in virtual visits in our patient care efforts even before COVID. So that really helped us very quickly when the pandemic hit, shift significantly to virtual visits. If you look at our outpatient visits at Cleveland Clinic, before the pandemic, about 5% of those were virtual. At the height of the pandemic, it was 70 to 75%. So very quickly, we were able to shift our caregivers over to virtual technologies to really help ensure that our patients' needs continue to be met using a virtual platform. I think the other thing that was important and that I already mentioned is, the use of virtual technologies like Zoom and Skype and Microsoft Office and other virtual platforms, and allowing us to continue to work effectively remotely from home. I think very quickly we all became expert in how to best use these technologies to keep our teams connected, keep the work going on, keep us working not only as individuals but as teams. And I think that was really essential. And I think if it, I often wonder, as others do, if we didn't have, this technology and we are trying to do this via conference calls or emails, how much more frustrating these last several months would have been.
Definitely, I agree to that. And I think the essence of the situation lies in the fact that people were able to overcome these challenges really quickly. The turnaround time was very
Mm-hmm.
faster, and the adaptation and to have that flexibility to adapt to the current situation and implement technological innovations within your infrastructure to ensure that the efficiency or the productivity is not affected.
Mm-hmm.
So with that, I'd like to move on to the another question is, when we talk about technological innovation, a lot is being talked about it in the current time, but how do you maintain this current innovation momentum beyond COVID-19 and overcome long-term regulatory, technical, cultural challenges? Your thoughts on how we can sustain the healthcare innovation in the new normal and beyond?
I think in a lot of ways, not only did COVID force us to innovate and to use new technologies, but I think in a lot of ways it really accelerated movements that were already there. So I think to that effect, I think even after hopefully soon we're over this pandemic, a lot of these things that were kind of percolating anyway, like virtual visits, are, now that everyone, many more people have gotten a comfort level with them, will continue to be used. But I think the difference there is we'll be able to better think about what is their place in, the way we run our operations or the way we interact with patients, the way we interact with each other as caregivers. And what I mean by that is, we were forced to pivot to virtual visits. We were forced to use virtual technologies for meetings and other things during this time when we had to be separated physically. As we start to come together physically again with the proper precautions and hopefully with more progress in the pandemic, we can really think about how we can continue to use some of those technologies when it's most appropriate. So it becomes another tool in our toolbox rather than the only way we do things.
Exactly.
And I think having seen the advantages of virtual technologies, virtual visits, et cetera, I think COVID forced us to overcome that initial barrier to application, barrier to adoption. So I really think now we're all going to be more comfortable moving forward to continue to use these technologies and hopefully to try new things as they come along that are even better tools for us.
True. And I think that has actually brought down the apprehension bar as well, because
Mm-hmm.
as we said that earlier, that COVID had well, it's a pandemic in true nature with its negative impacts, but it's also taught us a lesson that definitely that we need to imbibe and move forward in order to be prepared for any future health crisis. God forbid that
Mhm.
happens, but still.
Yes.
Uh, I'd also like to mention that in the current time, we are talking a lot about consumerism in the healthcare sector, unlike other retail, unlike other sectors where we talk about like hospitality, retail, banking. Now, this agenda is moving forward and taking a lot of importance within the healthcare domain, and that has definitely put a patient experience under spotlight. Cleveland Clinic is predominantly known for its guiding principle of patients first. Would you like
Mhm.
to kindly elaborate on this approach and how do you embed this in the organizational DNA?
Yeah, absolutely. That's a great question. I think, patients first at Cleveland Clinic is much more than a motto. It truly is the way we do things. It is our North Star. And I can really speak to that from my many years of experience, both as a doctor and a leader in the organization. I think one of the ways that we do that is by being led by clinicians. Cleveland Clinic was founded by doctors, and doctor physician leadership has continued to be a hallmark of the way we do things at Cleveland Clinic. And I think more broadly, it's not just physician leadership, but it's healthcare professional leadership in terms of doctors, nurses, pharmacists, physiotherapists, people who have experience taking care of patients, contributing to leading the organization. Okay. And I think what that allows you is it inserts the perspective of the patient and individuals who care for patients every day into the leadership of the organization. And it ensures that whenever important decisions need to be made, the people are really thinking about and understanding what's best for the patient. I think the other thing that we've been able to do is develop a very robust mechanism to allow patients themselves to have a say in everything we do. We have a program called Healthcare Partners where patients are really brought in on a regular basis to either give feedback on plans that Cleveland Clinic is hatching or to actually help design new services, new physical spaces, to make sure that that patient voice is heard from the very start. And there's that true co-design, which is what we always strive for. And then just anecdotally, I can't tell you how often, at meetings that I've been in where decisions had to be made, um, you know, people look at each other and ask, and they come down to what is the patient's first answer here? What's the best thing for patients? And it's so refreshing to know that, we all speak the same language at Cleveland Clinic, and when important decisions need to be made, we're always looking to what's the quote unquote patient's first answer.
True that. And I think since you said that patients are healthcare partners, and that truly is the same because healthcare patients are at the center around which the healthcare actually or
Mm-hmm.
predominantly should revolve around. Having said that, what strategies can we use to make healthcare truly responsive to patient needs and preferences once again, since we are facing the current ongoing pandemic? And if you could
Mm-hmm.
redesign healthcare delivery, what key things would you like to change to transform patient view of the service experience?
Mm-hmm. Well, I certainly think that, in the current pandemic situation, and even at the height of it in the US and other countries, we certainly didn't stop keeping patients first, and, we didn't stop seeking patients' input in all the decisions we were making. I think the biggest challenge that our patients faced in Cleveland and in other areas where we're operational is um, limiting business hours. Limiting visiting hours and restricting access to our healthcare facilities. Healthcare is obviously the most, is a very stressful situation, and a stay in the hospital is one of the most stressful things that a patient will go through in their lives. And being able to not have family members or other carers there with them because of restricting visiting was a big challenge for us, and something that clearly we had to do based on weighing the pros and cons of the potential for infection. And I think the important thing there was always being able to explain the why to our patients, to make it clear that this is something that we didn't necessarily want to do. We realized that it was going to have a negative impact on their hospital stay and their support there, but at the same time, really continue to reemphasize why we had to do this in order to keep our patients and frankly, our caregivers safe and minimize contact with people who might have infection themselves. So I think that looking forward, the most important lesson that we can keep in mind for patients is to really think about flexibility. As we've already said in this discussion, we've learned a lot about new approaches to old problems during this pandemic. Many of those are technological. So now I think hopefully as the pandemic continues to loosen, we'll have the luxury of, continuing to use those when it's best, and most importantly, when patients want to use them, when it's their preference. But we'll have other options for them. A patient can decide whether to have a live visit with their provider or to have a virtual visit because they feel that that's more convenient for them, that will allow them to get the care they need. And I think that's the key lesson here that we all could take advantage of.
I'm sure Cleveland Clinic London is going to take forward the legacy of the Cleveland Clinic Ohio and keep patient experience as the center stage of all the healthcare activities. And when we talk about delivering, this is an ideal situation to be in, is where every healthcare provider, their vision is to deliver exceptional patient experience at every single touch point. But having said that, I'm sure it's easier said than done. A lot of things do come in its way to achieve that broader vision or the goal of delivering exceptional patient experience at every single touch point. And what, according to you, are those barriers in achieving those goals? Would you like to share any of your best practices that echoes the ethos of Cleveland Clinic on a broader level?
Yeah, I think there's certainly a lot of barriers to optimizing patient experience at every touch point. I think one is just assuring that everyone who a patient or their family and carers might encounter during their journey, all are demonstrating empathy. All are aware of what the patient's going through, really seeing things from their perspective, and have the proper training to deliver care and communication to them with that empathy. Okay, and I think one best practice that's been developed in Cleveland that we're really happy to be bringing to London is something called Communicate with Heart, H-E-A-R-T. Communicate with Heart is a program that all of our caregivers, and at Cleveland Clinic, when we say caregivers, we mean all of our employees, whether they're patient-facing or otherwise. All of our caregivers at Cleveland Clinic get heart training as part of their initial induction. And heart is basically the basic communication framework that teaches us not only how to engage in an empathetic and engaging way with our patients, but also with each other. And we have started already training our current employees in Cleveland Clinic London on communicating with heart, not because we're taking care of patients now, and not just because we will be taking care of patients in another year, but also because we're interacting with each other every day. And that heart training, certainly makes us more empathetic and caring in our communications with each other, and it makes us more effective as an organization.
True that. I agree to that wholeheartedly. And now brings me to the last question, but not the least, of this very interesting session that we have with you. As a speaker at our upcoming Patient Experience and Engagement Summit this October, what is that you're most looking forward to as part of the experience that you would expect or reckon to have?
Yeah, I am really looking forward to it. Unfortunately, given the circumstances, it's going to be virtual, but I think we've all learned how to make the best of that. And really what I'm looking forward to is hearing from people from all over the world on their perspectives around how to improve patient experience. In Cleveland Clinic in London, we have a motto of we want to take the best of the US and meld that with the best of the UK in terms of making an optimal care experience. This conference really is the opportunity to take lessons from people all over the globe, really share our best practices and bring back a few things back to our own organizations that are going to make us better and make the experience better for our patients.
Truly said that. That's actually the objective of our event as well, put in a nutshell. That's great. It was an absolute pleasure to have you share your very valuable inputs today. We much appreciate your time and effort. So, with that, I would like to conclude this session with a key message that more than ever before, it is critical for healthcare organizations to prepare for future by acting now and doubling their efforts to elevate the human experience for the caregivers and the patients, building their trust and gaining long-term loyalty. Looking forward to hearing more from Dr. James and many other PX veterans at the second annual Patient Experience Engagement Summit 2020 this October. Do join us to unfold the new, uncompromised, and exciting experience innovations promising person centric care delivery in the era of COVID 19 and beyond. Thank you very much.
Thanks, Zenab. I'm looking forward to it as well.
Thank
Thanks
you,
all.
Dr. James.